Welcome everyone, and thanks for joining us. I'm Dr. Becca Bell. I'm a pediatric ICU doctor at UVM Children's Hospital, and we are so happy to have all of you here with us today to learn a bit more about the COVID-19 vaccine for children under 5 and to get your questions answered. So I'm here with Monica Benjamin, who's a nurse practitioner at Porter Pediatrics and takes care of kids of all ages. And before I turn it over to her, I'll let you know what this hour is going to look like. So Monica is going to present some information. So information on the COVID-19 vaccine for children under 5, including information from the clinical trials and some of our frequently asked questions. So many of your questions may be answered during her presentation, but feel free to go ahead and start putting questions into the Q&A. Whenever your questions arise, go ahead and put it in. The slides take about a half an hour to go through. And then after that, I will read your questions to Monica and have her answer them. Just so you know, hopefully everyone will get their questions answered. If there's a lot of very similar questions, I might kind of summarize them and present them to her. But feel free, we want this to be a back and forth. Nobody else can see your questions except for us. So feel free to, no question is too silly to ask. That's what we're here for today. I also want to take a special moment to thank Virginia Clark, who is our ASL interpreter for today. And hopefully you can all see her on your screen, and please let us know if you're having any trouble with that. This session is going to be recorded. It will go on our website. And if you find it helpful, we would love for you to share it with friends and family who couldn't make it live. So with that, I'm going to turn things over to Monica Benjamin. Thank you so much for being here.
Thanks, Dr. Bell. So yes, just like Dr. Bell said, we'll be reviewing the COVID vaccine for kiddos 6 months to 5 years today. And please ask questions. It kind of helps make the presentation more tailored to your concerns. And so always happy to ask those questions. And if any questions pop up afterwards, reaching out to your local pediatrician can help to answer those questions too. Next slide, please. So these are some of the common questions we've got from doing these Q&A sessions. Does my child need to get vaccinated? What are the differences between the two available vaccines, Moderna and Pfizer? What are the risks of vaccination? What are we actually protecting our kids from? And what if my child has already had COVID? So we will be reviewing all of these today during today's presentation. Next slide, please. So who should get vaccinated? So the Centers for Disease Control and pediatricians and other pediatric medical professionals recommend that all children 6 months and older who are eligible for vaccine get vaccinated, regardless of if they had COVID or not, or if they have an underlying health condition, it is still very safe and very much recommended that they be vaccinated against COVID. Next slide, please. So how do these vaccines work? So the COVID vaccine works very similarly to other vaccines your child may have already received. So we have the pathogen of COVID, which is the SARS-CoV-2. This invades our body and multiplies as it is in there. And what happens is that vaccine stops the virus from multiplying and helps the immune system make special proteins called antibodies to help fight off the virus once it has entered the system. After vaccination, your child has a lower chance of getting COVID, although they still might get infected. This vaccine is not meant to prevent every single COVID infection. We still have breakthrough infections, just like with the flu vaccine. However, if they do get COVID, it's very effective at preventing serious disease, which is the main thing that we are trying to prevent with any vaccine. Next slide, please. So, the COVID vaccine helps prevent against serious illness, hospitalization, and death, and those who do end up getting COVID. And then vaccine immunity lasts longer and is more effective than infection-induced community. So we have a lot of questions around like, well, I've already had COVID, like, do I really need to get the vaccine? And so, we know that after having had COVID, your natural protection lasts maybe 90 days, but it can only be a couple of weeks in some people. And we don't really know what your body's response is going to be. We know that with vaccine immunity, it lasts much longer and you have a much broader timeline of protection against COVID. Next slide, please. How do we know that these COVID vaccines are safe for our kids? They are really safe and effective for adults and children. There have been multiple control trials that were done for each age group. I think if you might recall that earlier this year, we thought that we were going to start immunizing kids in February. And then we said, wait, we need to get some more data to make sure that we're going to give the correct doses and the correct timing of doses. And so, we, just like with any vaccine, we say, okay, we got to make sure that everything is set and ready to go before we actually start vaccinating. And these vaccines continue to be monitored extremely closely. The Centers for Disease Control says that COVID-19 vaccines will have the most intensive safety monitoring in US history. Any adverse event that happens gets reported to the adverse event monitoring system. We are still monitoring the effectiveness of the COVID vaccine against the various strains of COVID that we've seen. And we'll continue to do so as COVID continues to evolve. Next slide, please. So there's 2 vaccines available for kids aged 6 months to 5 years, and those are the Moderna and Pfizer vaccines, and both are mRNA vaccines. mRNA stands for messenger RNA, and this gives instructions to the body that make a harmless spike of protein that looks like this protein's on the virus. And so what happens is the immune system will then make antibodies against the spike protein so that if you do get in contact with COVID, those antibodies start to fight against it. The mRNA disintegrates very quickly in our system and does not interact with the body's genetic material. So it's not going to change your DNA or make anything different. You're not going to pass along anything to future children because you've gotten this vaccine. It is very safe and very effective and a great way to help fight against COVID. Next slide, please. So here's the kind of the breakdown of what we've seen and how they have been working. So to date, over 580 million of mRNA vaccine have been given in the United States alone. And over 10 million children ages 5 to 11 have received at least 1 dose of the COVID mRNA vaccine. This can be either Pfizer or Moderna. And over 17 million adolescents aged 12 to 17 have received at least 1 dose. So we know that, this is just in the United States, and worldwide there's been even more. And so we, 27 million doses given to our children alone to this date. Next slide, please. And so here's some information on the clinical trials for both of these. So for the Pfizer vaccine, it included children aged 6 months to 4 years, and the Moderna was 6 months to 5 years. And it included children who had had COVID and those who had not had COVID. It also included children with and without underlying health conditions. So it kind of encompassed a broad range of kind of everything that we could come across in kids, regardless of their health status and their prior COVID infection status. Next slide, please. So we're going to talk about side effects now. Some children have no side effects at all, except for, some tears afterwards, because, shots hurt. Just like any shot, there are going to be some tears. They might have a little bit soreness afterwards. But the most common side effects that we've seen for this age group include that localized reaction. So pain at the injection site, redness or swelling at the injection site, just like we can see with any other vaccine in this age group. And then we're seeing those systemic symptoms, those things that affect our whole body, occurring at a much lower age in this age group than adults. The most common are fatigue and irritability and seem to be mild. These side effects are extremely temporary and are going away within a few days for these kiddos. Next slide, please. And so here's just some information specific to the Pfizer vaccine. So the dose for the 6 months to 3 years, you can see there, is much lower than the dose for the 5 to 11-year-olds and even lower than the dose for the 12 and older. It's lower because we know that the immune system has responded well to that dose. And so we said, okay, this is the dose that works for these kiddos, and we don't need to kind of do a higher dose because they're having an adequate immune response with this dose. We're seeing a similar immune response to the 16 to 25-year-olds after 3 doses, and there have been no serious adverse events related to the vaccine. Next slide, please. And so here's kind of the overview. So in phase 1, there was 64 participants aged 6 months through 4 years. we identified the dose that was working well for these kiddos. And then in the phases 2 and 3, there was 65 clinical trial sites, a 2-to-1 randomization, which means that, most people, 2-to-1 being the two being the people that received the active vaccine and 1 being what received the placebo vaccine. And so you can kind of see they're broken down there. So in the blue rectangle, that's the number who received the vaccine. And then the red box is the people who received the placebo or a saline injection. And so non-inferior immune responses have been established to infer vaccine efficacy. So we kind of compared this age group to the 16 to 25-year-olds from their phase 3 study. And then, although it wasn't required for the EUA approval, the COVID-19 surveillance was conducted, permitting evaluation of vaccine efficacy so that we can know how effective this vaccine would be for kiddos in this age group. Next slide, please. And so these are the systemic events that were monitored for during the trials for 7 days after each dose, mostly mild to moderate as previously mentioned. And so dose 1, really small percentage of kiddos with fever or fatigue, seeing some diarrhea, headaches, and subsequently with each next dose about the same response in terms of what we're seeing for those side effects. And so really mild, occurring within 7 days or less after each dose and going away after that, and have been really well tolerated. And because I can say here in our office, parents and children have been really excited about this vaccine and have been so happy about it and not calling us reporting a lot of side effects whatsoever. Next slide, please. And then, so, kind of some more events here that we are seeing between the placebo doses and the vaccine itself. And so, again, this is kind of, we're not seeing any severe or grade 4 reactions, and very well tolerated. And typically, with the decreased appetite, drowsiness, irritability, fever, those can kind of go hand in hand. If a fever, you might not feel so well, so you might be kind of sleepy and drowsy and irritable and not want to eat a whole lot. And very safe to give Tylenol or ibuprofen to kids after vaccine if you're noticing any of these reactions happening. It's not going to decrease the effectiveness or interact with the vaccine in any way. Next slide, please. And so now we're going to talk about the Moderna vaccine. And again, you can see the doses here. And again, for this age group, the dose is lower. And again, similar immune response in the 16 to 25-year-olds after those 2 doses. And again, no serious adverse events related to the vaccine. Next slide, please. And so these are the numbers of kiddos that received at least 1 or more dose of the Moderna vaccine. And you can see the 2 to 5 and the 6 to 23-month-olds there. And the total number, there's about 5,000 doses given there, with about 1,500 placebo doses being given. And so we're going to now look at the side effects noted from the Moderna vaccine. Next slide, please. And so again, the systemic reactions within 7 days after dose 1 and 2. So similar to Pfizer, as you're seeing the headache, the fatigue, body aches, joint aches, nausea, vomiting, chills going on. And the blue columns are the people who received the vaccine, and the gray columns are the ones who received the placebo. And so you can see across there that, again, everything has been relatively mild to moderate symptoms, and no severe events reporting. Next slide, please. So here we have some more systemic reactions: irritability, crying, sleepiness, loss of appetite. And you can see, comparing, again, the blue is those who received the vaccine, and the gray are those who received the placebo. And really, again, mild symptoms here, well managed, nothing adverse that we're seeing here that required further intervention besides what you would already do to take care of your kiddo at home. So very safe and effective, which is excellent. Next slide, please. And so these are what we're monitoring now for fever. And so the color patterns follow that similar pattern that we've seen in the previous 2 slides. And so this actually gives some fever ranges, which is kind of great that they broke it down in here into like the 100.4 to 101.1, et cetera, across the board to greater than 104. And, we tend to think about fever and, okay, that's our body's natural response to building up immunity, to fighting off an illness, to fighting off infection. So when we have that fever, your body's doing what it should. And some people get fever with the vaccines and some people don't, and that's totally normal. Oftentimes we get a lot of questions about fever being like, oh my gosh, if my fever is over, like my child's fever is over X number, do I need to immediately go to the emergency room? And I always educate parents around, okay, it's not what the number of your kid's fever is, but how are they reacting? Is the fever responding to Tylenol and ibuprofen? Are they able to drink? Are they feeling comfortable? I can see the kid with a fever of 104 running around my exam room in the office totally fine. And then I can see the kid with a fever of 100.5 who's laying in their mom's arms and not really responding to when I'm doing their exam. I'm much more concerned then about the kid with a fever of 100.5. So it's really just monitoring your child and how they are responding to that fever than what the actual number of the fever is itself. Next slide, please. And so we heard a lot about myocarditis in some of the COVID vaccines for adults, and there have been no cases of myocarditis in young children who received the vaccine during the clinical trials. However, we do know that there is an increased risk of myocarditis in the 12 to 17-year-old age group in males after the second dose of mRNA vaccine. However, it is still extremely rare, and even the group most effective, the 16 to 17-year-old males, the rate of myocarditis after the second shot is about 1 in 10,000 or 0.01%. So still a very rare event to have happen. Next slide, please. And so this is some more information about the vaccine-associated myocarditis. And so, in young children, these less than 12-year-olds, it's unknown, right? But we haven't seen any to date. And what we know about myocarditis and safety monitoring the 5 to 11-year-olds is that it is anticipated to be very rare. And so it's different in infants, but the dose used in young children, the 6 to 5 months old, is lower than the dose used in older children. So we anticipate that the risk for myocarditis is going to be extremely rare as well, based on this lower dose and their age. Next slide, please. And so we're going to talk about COVID infection-induced myocarditis versus vaccine-associated myocarditis. So COVID infection itself can cause myocarditis in children. So that's kind of one of the things that we worry about with kids getting COVID. And a child is much more likely to get myocarditis from COVID than from the vaccine itself. In addition, the vaccine-associated myocarditis is much more mild than the myocarditis we're being seen caused by COVID. So weighing the risks and the benefits between those two, the vaccine is more likely to prevent myocarditis than to cause it, right? Because our vaccine is preventing severe complications from COVID. And so I would, if you're asked me, I would say, oh yes, the vaccine is going to be helpful in preventing myocarditis. And if it was very rare that it were to happen, it would be much more mild than we would see from the COVID infection itself without vaccine protection. Next slide, please. And what about those late onset side effects that we could be worried about with the vaccines? We have seen no new side effects that have been documented after 8 weeks post-vaccination. And that's one of the things they monitor in the clinical trials, and one of the things that have continued to be monitored as time has gone on since we first saw the COVID vaccines introduced back in the winter of 2019. And there's no biologic mechanism by which the vaccine could cause a new long-term program, since the mRNA degrades within days. So it's not going to interact to cause all of a sudden some new genetic concern within our bodies, or some new health issue that would be caused by it. Next slide, please. And so what about the risks of COVID-19 infection in the 6-month to 5-year-old age group? So we're going to review those risks of getting COVID within this age group now. Next slide, please. So here are what our COVID-19 hospitalizations look like. And you can see here, this big surge is when we had Delta going around this winter when we were having those hospitalizations. This is your 0 to 4-year-olds, and this is your 5 to 17-year-olds. Now keep in mind that within this age group here, by this point in time, we were seeing some immunization protection for those 12 to 17-year-olds. And these are the kids that had not received any vaccine yet because it was not available. So you can see that the kids that hadn't had the vaccine are at a much higher rate to be hospitalized than those who had received the vaccine. Next slide, please. So you can get pneumonia from COVID for kids, and this can lead to low levels of oxygen in the body, requiring hospitalization so that you can get adequate oxygen so that your body can continue to function and that your lungs can continue to move their blood through your body so that you can have adequate response to treatment for COVID pneumonia. And this can also require support from machines in breathing if your oxygen gets so low that we're unable to just, maintain oxygen by giving just the oxygen itself. And so far, we have seen this complication more in unvaccinated adolescents than in any other age group. Next slide, please. And then we've heard a lot about MIS-C, or the multi-system inflammatory syndrome in children. And so this requires, a case identification, among other things. So it has to be laboratory evidence of inflammation, evidence of severe illness requiring hospitalization, and 2 or more organ systems involved. So myocarditis, which we've previously talked about, may be present and can be really severe in these kiddos. And they also have to have recent or current COVID infection coinciding as well. So within the United States, there have been about a little over 8,000 cases, and there's been 70 deaths related to this, unfortunately. And so this is where we're talking about where the vaccine can help prevent these things from happening. Next slide, please. And so here we can see, this is the data as of late June, that here's how much MIS-C is happening. You can see it happening the most in this 5 to 11 year age group, and less so in the younger age groups and the older age groups. So our adolescent, early childhood adolescent age group is definitely being most affected by this right now, but still occurring across all age groups. It's not like there's any age group that's left out of this right now. Next slide, please. So that we're going to talk about the pediatric hospitalization. So other reasons for kids that needing to be hospitalized due to COVID can be croups. That's an inflammation of the upper airway that causes that seal barky cough. They could have underlying asthma, and it can cause an asthma exacerbation. Decreased feeding or oral intake can lead to dehydration, and inflammation of the organs, including brain. So these are things that we would never wish upon any child needing to be hospitalized for any of these things, and COVID can definitely put them at higher risk for these things requiring hospitalization. Next slide, please. So severe COVID cases in our state right now. So Vermont's high adolescent vaccination rate protected our youth from severe COVID disease as cases rose due to the Delta variant over the winter time. In addition, we saw a high vaccination rate for our kids 5 to 11 years old, and they also protected against severe disease during the Omicron variant that came about. And so we've been really lucky that with these high vaccination rates, that we have seen fewer cases of this than we have in adolescents across the country to date. Next slide, please. And so what about if your kiddo has already had COVID? What should we do about them and their vaccine status? Next slide, please. So we know that you actually have an improved antibody response to the vaccine after having had COVID. So what we have seen is that those kids vaccinated with 2 doses of mRNA vaccine demonstrated higher levels of antibodies against the alpha, beta, gamma, delta, and Omicron variants. And it may suggest that the antibodies produced by prior COVID infection may not neutralize the current circulating Omicron variant. And this builds upon the evidence among adults that the previous infection provided poor protection from infection with Omicron. And it highlights the importance of vaccinating children without prior infection to prevent both severe disease and future infections. So while we see that robust immune response after having had COVID, it's even better to prevent COVID from happening in the first place if we are able to. And also to prevent severe disease, as we already kind of reviewed those things that can happen with severe disease in this age group. Next slide, please. And so it is very safe and is recommended still to vaccinate all children, even if they have previously had COVID. It's okay to vaccinate as soon as a child is done with their isolation period. And it's also okay to wait because we talked, there's a brief window where you have some natural immunity. The CDC says you can wait up to 3 months after infection before a vaccination. And the increased time between infection and vaccination may result in improved immune response to vaccination. However, it's also safe to get vaccinated 10 days after having had infection and don't need to wait those full 3 months at that point in time. And it will help to build up their protection against future infection. Next slide, please. And why is the vaccine based on age and not weight? So vaccine dosing is not based on weight because vaccines are not a medication. Vaccines presents information to the immune system to prompt it what it would normally do if it were to come in contact with this disease. Younger children's immune systems needs less prompting to responding because they're more adept at responding quickly. So the vaccine dose based on immune system maturity rather than weight itself. Next slide, please. And what about getting other vaccines at around the same time as the COVID vaccine? It's great. It's totally safe to give all routine immunizations at the same time as the COVID vaccine. So your kiddos coming in for their 6-month checkup, they'll get their normal vaccines they would get at 6 months plus the COVID vaccine, and it's very safe to do them all together. It's not going to affect the immune response to one vaccine or the other. Next slide, please. And so we have a lot of resources on healthychildren.org, which is the American Academy of Pediatrics website for parents and caregivers. And this is kind of the FAQ landing page about COVID vaccines for kiddos 6 months and older. And so you can navigate over into that at your leisure and find some more information and a lot of information that we covered here today as well. Next slide, please. So how is it looking so far since we were able to start vaccinating in June? So as of the end of July, over 800,000 children ages 5 and under have received a COVID vaccine in the US, and about 5,000 Vermonters under 5 have received the vaccine. And most have received in the medical home, and it's been a 50-50 split of Moderna and Pfizer. Next slide, please. So where can we get vaccinated? At your child's medical provider. The Vermont Department of Health has some walk-in clinics. Some pharmacies will vaccinate kids ages 3 and older. And if you're a WIC client, the vaccine is also available at WIC offices. And if you ever have questions about it, you can always call your child's medical home. And even if they aren't providing the vaccine, they'll be able to direct you as to where to get it locally. Next slide, please. And so this is a great, the Vermont Department of Health vaccine question and answer page, little arms for the COVID vaccines for children 5 and under. And so you can see where they have the health department clinics and, where you are able to get it around the state at this time. Next slide, please. And so here's the walk-in clinic. So this is just an example if you're looking for the walk-in clinics and, what's available and what age groups. You can kind of look at the dates and where the site is and the time, and then the vaccine type. And, for this age group, we're looking for those kiddos, under 6, under 5 to be able to get their vaccines. And of course, it's available for other age groups as well throughout these sites. Next slide, please. And so yay, our kids that are younger, that we've been waiting, it seems like for forever for this vaccine to be available, they can now get their vaccine, which is beyond exciting. I know we've had, as soon as they're approved, we in our office had so many parents call, and it was so exciting to receive that shipment and be able to give it to these families who felt like they have been waiting a long time for their young kids to be able to get this vaccine. So it's a really exciting time right now, especially with school starting up again, that we can help protect all of these kiddos. Next slide, please. So I'm going to open it up to the question and answer session at this point in time. And thank you all for coming today.
Thanks so much, Monica. I wanted to give you a sec to catch your breath. And I know there are people who joined after we had sort of started. And so I wanted to let those folks know that this session is being recorded, and so it will go on our website. So you're welcome to check back later and to share. And now we're open to Q&A. So I would love to hear from folks about, we have a couple questions already, but what questions you have. So Monica, I kind of wanted to start with, there's a really good question, and this came in before you talked a little bit about the difference between age and thinking about weight and dosing and all that with kids, but I'm wondering, it's such a common question. If you could talk just a little bit more about that, because I'm sure there are families in your clinic who are asking. So really thinking like this person saying, there's a lot of variation in those ages. Many under fives are larger than older kids. So first of all, you have a 6-month-old getting the same dose as a 4-year-old, right? And that's like a huge different size difference, right? And then you've got 5-year-olds who are bigger than, who are smaller than 4-year-olds. And then I think I'll just add on, because this is also a common question, is like, you're a parent of a 4-year-old who's turning 5 this fall. How does that work with the dosing? And if you could kind of go into your spiel on that, that would be super helpful.
Definitely. So vaccines are not a medication. Vaccines help our immune system respond to diseases. So a 6-month-old immune system is just as mature as a 4-year-old's immune system. And so we know that by giving them the same dose, regardless of their weight, their immune system is going to have that same response. So yes, there are definitely huge variations in sizes for kiddos across this age group, you know, with the larger, smaller, all over the place, really. Everybody's at different rates of growth and at this point in time, but we know that the immune system isn't affected by that growth. The immune system has its maturity, and based on what that maturity is how we vaccinate kiddos. I honestly, and in terms of like, you know, the 4-year-old going to 5-year-old, I have to pull up my resource because I know here in our office we're doing one thing, but like the AAP recommends something slightly different. So I would have to find that resource. Just give me like a couple of clicks. I know exactly where it is.
So
and
one
great
short answer is like, you get the dose that's associated with the age that you're in the clinic. You are when you're getting the vaccine, right? So like to simplify it, if you come to get your vaccine and you're 4, you get a 4-year-old, you know, that dose. And then if you turn 5. Now, I think a little bit, what can be kind of confusing for families is that the Moderna and the Pfizer cutoff is a different age, right? So for Pfizer, it's 4 turning 5, and for Moderna, it's 5 turning 6. So, and I don't know, and then there's also the question about the number of doses as well too. So,
yeah. And I think, and please correct me if I'm wrong in this, Dr. Bell. So if you have a 4-year-old that started the series, say they've gotten 2 doses of Pfizer, we are saying then even if they turn 5 to complete that 3rd dose, because when we started the vaccine series, they were 4. And then, you know, we have some questions about like, well, should I wait till I turn 5? And we're telling people, no, if you have the opportunity to get vaccinated right now, get vaccinated for the age that you were at. And then, you know, we'll complete that series from where you started.
Yeah, that's a great point about waiting, because another common question is about lots of families are hearing about ongoing testing that's happening right now with the bivalent vaccine, right? So we've got vaccines out there that are being studied that include an Omicron strain. So this is being studied both in adults and in children right now. And so some families are saying, well, if that might come out soon, should I just wait? And so if folks really have a question more about that upcoming Omicron included vaccine, what's your advice there?
I'm going to give my personal advice, which I don't know is any evidence-based right now, but we have no idea what that timeline is. So you could be waiting a long time for that vaccine to come out. And I feel as though as we've seen, like, you know, booster doses rolling out for all of our age groups, except for the 6 to 5-year-old age group so far, that, you know, once the bivalent vaccine is available, they're going to have some booster rules around that too, if you haven't received it yet. And so I think, again, taking the vaccine that is available now instead of waiting an unknown amount of time for what may happen in the future is going to give you the best protection that you have. Especially, you know, again, we mentioned briefly, like, school year starting. We know illnesses surge when kids are back together, and I'm sure we'll see a little uptick in our COVID vaccines as our kids begin to go back to school and share all their lovely germs with each other, as we do at the start of every school year with all kind of common childhood illnesses at this point in time.
So what about if you're a parent of a child who has an underlying heart condition or some other underlying medical condition, and you feel sort of nervous about the vaccine? What kind of advice do you give? Are there any conditions, childhood conditions, in which you would recommend not to get the vaccine?
Yeah. So there's no contraindications to the vaccine right now, which is great. And then, we talked about, we know that kids with underlying health conditions are already set up to be higher risk to have those severe complications from COVID. So being able to give them the best protection that they can have to prevent those severe complications from COVID is fantastic. And, again, within the clinical trials, they included kiddos that did not have underlying health conditions as well as those that did. And so we know that, again, the side effects that we have seen and the protection that we are seeing has been studied across all those groups. And so that to me is really reassuring, and also can provide those kids who might be medically fragile to say, hey, here's the best protection that we can give you right now to help prevent these really serious, complicated things from happening from COVID.
And what about for the families that say, my kid's totally healthy, they've never been hospitalized, they've hardly ever had a fever. A lot of kids in this age group, well, not so much lately, but avoided a lot of infection during COVID because there wasn't as much of other stuff going around. So my kids never had a fever, they've never had a problem, they've never gotten an antibiotic. Do they really need the COVID vaccine?
Yeah, and I will say that across this age group, yes, these COVID infections are generally mild. The one really kind of thing that throws us off of COVID is that it doesn't matter if you're totally healthy or you have an underlying health condition or you've had like one ear infection in your life. We don't ever know what your body's response is going to be to COVID until you have it. And sure, you could be very fortunate and have a super mild case and not have any complications. As a parent and a healthcare provider, my job is to provide kiddos with the best protection that they can. And if I can prevent even one kid from being hospitalized from COVID by giving them a COVID vaccine, I will consider it well worthwhile. So that's the weird thing about COVID, is that we don't know who it's going to affect the worst until it happens.
Okay, we have a few more questions about timing of vaccine. So when does protection wane? So this person says, for example, if you get flu, I think they mean the flu vaccine really early, I'm adding in the flu season, you may not be as protected by the time, by the spring. So is there any way to time the vaccine, thinking about like when protection might wane, and how do you sort of advise around that?
I'm going to defer that question to you, actually, because I don't know the best answer for
Yeah.
that one.
I think, this is a super common question, right? Because everyone, people understand that you can still get infected even if you're vaccinated, and people understand that right after you get vaccinated is sort of when you have that biggest boost in your neutralizing antibodies, and you're most likely to be protected from infection during that time. Now, again, I'll go back to what Monica said before, which is that these vaccines protect against serious disease. And that is really the most important part of the aspect of the vaccine. And so you really want to, I think, about getting that strong foundation in. So I would say for the primary series, and when we say primary series, we mean like the first couple doses, whether it's the 2 or 3 doses, I would say go ahead and get those vaccines in, because that's the foundation to protect your child against serious disease. I think timing around boosters, you can kind of play around a little bit, if you're traveling or school's going to start or something like that, where you might want to get that vaccine, get that boost, right before you think you're going to be potentially most exposed. So you can sort of play around with the booster. I don't recommend waiting too long to get that primary series into children, because I think that starts the process of really getting their immune system the information it needs, starting to make those like antibodies, making those memory cells, getting ready for exposure. So we do wonder if at some point, like the flu season, we'll be able to predict a seasonal COVID season. And in that case, if we're able to do that, if COVID sort of settles into some sort of like seasonal routine, we probably will start recommending timing around getting boosters, right? Like the way the flu shot works, but we're not there yet. And so we don't really know. And I think the problem is that those neutralizing antibody titers they will wane, and the timing is just different for different people. And I think a lot of it has to do with the variants too. So we know that, people got Delta and then they got Omicron because those variants were so different. People can get Omicron reinfection, different types of Omicron. So I think the other piece that's hard to predict is if the dominant variant changes a lot, that, that protection might not be there. Whereas if the dominant variant continues to be the same, you might be well protected from infection for a long time. But really, bottom line is, I would say, go ahead and don't wait too long for that primary series. And then the booster, you can think a little bit more about playing around with the timing. Another question about timing. So you had mentioned, Monica, that it's totally safe to get the vaccine after a child's out of isolation after they've had COVID-19. So it's safe to get it. You can also wait the 3 months. The CDC says you can wait 3 months. So you could do either. The question this participant has is, what's better to do? So is it best to wait 90 days after COVID infection or vaccinate immediately after isolation? There is varying advice on this. And I feel you, there is varying advice. So what do you say to families about that?
Well, just speaking about primary series, right? So I'm going to just use the Pfizer vaccine, for example, because that's what we're using in our office, right? It takes about 11 weeks to be fully vaccinated, right? Because you get your first dose, and then 3 weeks later, you're getting your second dose, and then 8 weeks after that, you're getting your third dose. So sure, you could wait that 90 days, but then you're really waiting 11 more weeks after that to have that full protection from your primary series. So the recommendation is, I would say get the vaccine when it's available, when you're out of isolation, because you're almost up to that 90 days, 11 weeks to get that full protection. And sure, you could totally take that risk, or know that you'd have some natural protection, but then you're going to have to again wait that 11 weeks to get that full protection afterwards. And so maybe you want to wait like 45 days instead of 90, so you can kind of, by the time your 90 days is up, you're back to that full protection again, not full protection, but more protection.
What else, Monica, since you talked about summertime and back to school, what else are you talking about with families in terms of back to school and other childhood vaccinations? We've heard in the news about polio in New York. How are families thinking about getting up to date on their other vaccines?
Yeah, so I do want to give the caveat that the outbreak in New York is in a high rate of unimmunized kiddos within that community. So that's where we're seeing, we know that herd immunity provides a lot of protection. They don't have that within that community. Fortunately, in Vermont, we have really high polio vaccination rates, which is excellent. But definitely, your 2, 4, 6-month-olds and 4-year-olds are due for their polio shots. So yes, please get those during their visit. And it's a routine part of those immunizations. And it's typically given within a combination vaccine. For right now, we're using the Pediarix for the 2, 4, 6-month-olds, which is the DTaP, the hepatitis B, and the polio all wrapped in together. And then at the 4-year checkup or 5-year checkup, it's the DTaP and the polio together again for the Kinrix vaccine. And so it's very safe to give all of these immunizations together. Giving more than one immunization doesn't cancel out the immune response to one thing or another. And it's really safe to do. And that way too, you're not having to make a million trips into the office. And hopefully your kid will still enjoy coming to us instead of, every time they walk through the door, they're getting a shot, which definitely can make them a little bit more fearful of coming here, which we never want to do. Shots are never fun, but we want to protect kids as well, and really presenting it to them like, yeah, shots hurt, but we're protecting your body and we're trying to keep your body healthy here with this shot. And so just maintaining the up-to-date status on all routine immunizations is just as important as COVID. It seems like COVID is at the forefront of all of our minds still, 3+ years into this pandemic here. But we still have a lot of other diseases that we can help prevent against. Sure, we can't prevent against hand, foot, and mouth, which we're starting to see again right now, or common colds and everything. But who knows? Whooping cough could make a comeback this fall if it wanted to, or hopefully not, no more measles outbreaks or polio outbreaks, please. But it can always happen, right? Just because we haven't seen these diseases in a long time doesn't mean they're gone away for forever.
Yeah, and you just mentioned hand, foot, and mouth, and I wonder if we could just take a moment to just recognize how hard it's been for families with kids in this age group that we're talking to. So, families with kids under 5. I mean, what have you been seeing in your patient population in terms of illness, COVID and non-COVID and missed childcare and all that. Like,
Yeah.
how do you like build, how do you build families back up after this tough
I
time?
would say, it seems like childcare is starting to get back to pre-pandemic illness guidelines. It was really challenging over this winter where you had to be totally symptom-free to go back to childcare. That was putting a huge strain on families. And, I get it. It's a huge concern. We don't want to pass illnesses among kids, but parents also need to work, right? If parents can't work, they don't have an income, they can't care for their children. And then that begins that cycle of like, well, how do I get out of this place where I'm in? And how do I get my childcare for? And how do I also take care of myself? And so, I would say right now in the office, we're starting to see little pockets of hand, foot, and mouth. It's coming. It's the season for it. But we're seeing a lot of what I call viral creepy crud too. So and more of that than COVID right now. So we're starting to see just kind of like the common viruses, cough, runny nose, maybe a fever, maybe not. Whatever virus is going around right now has been causing a higher fever in kiddos for like 4 or 5 days, that like 102, 103 fever in this age group for a longer duration than we usually expect. But then kids are recovering from it just fine. And this is kind of that normal cyclical pattern that we see to viruses. I would expect it this fall and winter to pick up even more, as we were starting to see last spring as restrictions were loosening regarding masks and everything. Is that, these kids in this age group will get like 6 to 12 viral illnesses a season. And it seems like they have just recovered from one thing. And then, oh my gosh, we had like 2 days without a runny nose. And here it is right back again. I'm really happy to see that, we are moving a little bit away from like testing every runny nose that comes into the door, using a little bit more clinical judgment, like, have you had a COVID exposure? Is this coming on the tail end of another viral illness? Kind of like, kind of discerning when to test and when not to test. And also, we have such huge access to rapid tests right now too, which is great. And there's been a lot of talk of like, okay, these rapid antigen tests that are available over the counter aren't approved for kiddos under age 2, but the only reason they're not approved for kiddos under age 2 is that, worried about technique and getting a good enough swab. It's not that they aren't as effective as testing these kiddos. So if you feel confident in your ability to get some good boogers from your kid's nose and to get a good swab, and, they'll probably holler at you, you can test at home too, which is so great, rather than coming into the office. We do, and we're always happy to see you in the office, but we do a test and kind of just do the same things that you would have done at home in terms of symptom care, with managing a fever, sucking the boogers, encouraging them to stay hydrated. And so I hope that as we continue to kind of get back to our normal and we start seeing just our normal viruses going around, that people will not be excluded from childcare for as long as a period of time, and be able to go back, once they've been fever free for 24 hours, even if they still have a runny nose type of thing, knowing that we still have all of our other illnesses going around, not just COVID.
I would say, of a parent of small kids, that I actually think it's easier to hold down like a 1-year-old or a 2-year-old for a swab than a 4-year-old who's like able to fight and run. So
Yeah.
yeah, that was always kind of funny to me. In terms of parents and families planning, right? You just talked about all kinds of childcare disruption. Are you recommending that families plan that their child might need to miss daycare the next day? And on those graphs, it really was like the y-axis was really like 5, 6, 7% were having fever. So not that many. So do you
Yeah.
have a standard recommendation or no?
We don't. We just kind of saying, monitoring how your kid is doing and knowing that if they are feeling a bit crummy, maybe they do want to stay home and get some snuggles rather than go play. But maybe some kids want the distraction of, being at childcare and not thinking about the fact that they're feeling crummy. And so just kind of, I always just say gauge your child, right? You're the expert in your child. You know them best. If you think they'll be up for it, go ahead and go for it. If you feel like they need a day at home, then they get a day at home.
So I think we've covered all the questions. I'm gonna give folks a more chance if they have any last minute burning questions. And I thought I could hand things back over, Monica, if you have any parting last words or advice to families with kids in this age group. And again, we recommend that you chat with your child's medical provider as well. But we're so happy that you all joined us today.
And I will just say that I would never recommend anything to anybody that I would not do for my own child. So don't think that we're just making these recommendations and not wanting to do the same thing for our own kiddos. Our vaccine arrived in the office on a Thursday afternoon, and my daughter was in the office Friday morning getting her vaccine, and I was so excited. So it feels like a big relief at this point in time to give this age group some protection and feel better about play groups and preschool and all of those things that we want these kids to get back to doing.
Thank you again, Monica, for taking time in your busy clinic day to chat with everybody. And thanks all for joining. And we'll put this recording up on our website. Feel free to share. Thank you all so much.
Thank you.
Bye.
Bye.